I am Dr. Sudhakar Prasad, Senior Consultant Plastic and Cosmetic Surgeon at Apollo Hospitals, Hyderabad. Now, this technology which we are offering now is probably one of the latest one, and in Hyderabad, it's the Apollo is the only center where it is being offered. Conventionally, once you transfer a fat graft from one area of the body to another area, either for a cosmetic reason or for a reconstructive reason, most of the transferred volume, at least 40 to 50%, will be lost over a period of time, about 3 to 6 months. You lose that kind of volume. The second thing is it's fat cells which are not regenerative, which are fairly dormant. Now, with the new technology, what we are doing is isolate the regenerative cells, 2 to 5% of being them stem cells, and other various cells which are involved in repair. And if you mix them with the fat, and the fat volume loss is not going to happen. And in an injected site, a new repair also will happen. You don't need a second surgery, and your result is more or less permanent. And some of the conditions which require major repetitive surgeries for a cure are much simplified with this technique. For example, radiation necrotic ulcers. This is a wonderful technique in that area, because other alternative would be sequential operations lasting over a few years. With this, within a few months, you can get those recalcitrant wounds to heal. So I'm quite happy to be a part of this research team into this technology, and in about 6 months' time, we will be able to offer to across all people once we are through with our scientific committee. Yeah, we did few patients last week. We are very happy with the immediate results. Now, as I said earlier, we would like to observe the result for about 3 months or so. Then we'll come back. We have done some patients last week, and the immediate results are excellent. So we are waiting to follow them up and see in both the short term and the long term. We are going to do some more patients in the coming weeks. And once we have the results on hand, once we submit them to scientific committee again, and then we'll be able to offer to the public at large. No, this procedure without this cell concentrate is being done for quite some time, last 20 years or so. So this is refining the technique and improving the outcome, and without at the same time increasing the risks. No, risks are absolutely non-existent. We haven't charged these first patients because it's a part of a trial, and once the trial is through, so we'll work out the modalities and the cost factor.